Hi, my name is Ella Spears, and I will be doing a presentation on Parkinson's disease. Parkinson's disease is a progressive neurological disorder affecting the nervous system and the body's nerve control region. This is a very common disease and basically affects the movement of individuals and their level of tiredness, depression, things like that. What does Parkinson's disease mostly affect? It affects people over the age of 64. That's where it is most common. And then younger patients are classified as young onset Parkinson's. So basically anybody below 50 is young for Parkinson's disease. What causes Parkinson's disease? Genetics may be a huge factor into this. There are also new findings that environmental factors like exposure to certain toxins could be a factor. These individuals actually do not have enough chemical dopamine also, and there is a loss of nerve cells in part of the brain. Some symptoms of speech in the Parkinson's disease: they're very soft-spoken with no emotions. Sometimes you can tell they have like the mask-like face. They don't really show emotions even when they are happy or sad. They sound raspy or breathy. This kind of shows to other individuals that they seem like they're having difficulty breathing, but they're just raspy. Some mumbling, slurring of words, stop speaking in sentences. So basically they will just be speaking in a sentence and then simply just stop speaking, even when, again, they're just in a like speaking to somebody in a sentence. And then some might speak quickly, and then some might stammer, and you can't really like understand what they're exactly saying. Some effects of Parkinson's disease are motor symptoms and non-motor symptoms. Motor symptoms are the movement functions. These are like more of walking, running, like those type of movements. And then we have non-motor symptoms, which is affecting anything within the body by muscles. It's just more of like behavior symptoms such as like tiredness, depression, anxiety. And these symptoms actually differ on a day-to-day basis. They are not the same each day. So here's just a simple diagram of non-motor and motor symptoms. Some non-motor, again, like depression, sleep problems, loss of smell, sweating, and some gas issues. And then for motor, there's the shaking, the rigidity, the posture inability, and some vocal symptoms. And some vocal symptoms are the voice is getting lower. You can't really fully understand, or slowly to fully not understand them. And then here is just another diagram of the neurons and the reduced dopamine. You could see that in the first diagram to the left, the transmitting neuron is producing tons of cells to go into the receiving neuron with those sympathetic cells, and the dopamine, you could tell that is normal. There are tons of cells going into that receiving neuron. And then for the Parkinson's reduced dopamine, you can tell that the transmitting neuron does not have as many cells of dopamine going into the receiving neuron. So you could tell that there is a huge difference with the amount of cells going into that receiving neuron. Some early stages of Parkinson's disease.